So joining us now in the studio, getting us kicked off this morning, Mr. Tim Moore, President, CEO of the Mississippi Hospital Association. Morning, Tim.
Good morning, Jared.
It is beautiful outside, isn't it?
It is absolutely gorgeous.
And you got your seersucker on. You look great. I appreciate that, man.
I'm ready for it.
That is awesome.
Easter has passed. You can bring it out.
That's exactly right. We appreciate you coming in today. Wanted to talk about what's going on with Medicaid expansion, and of course, legislation did not really get any traction this year, as has been the case for some time, with respect to lawmakers moving forward with Medicaid expansion. But you guys at the MHA maybe are in favor of pursuing a different route, shall we say?
Yes, sir.
Tell us about that.
We are, and it's not just part of the MHA, but a number of associations and other groups that have come together to move it forward with a ballot initiative that, of course, was filed on or about February the 23rd and is moving through the process.
Okay, so in saying that it is filed, meaning it's official as far as registering with the Secretary of State.
That's
through
correct.
all the proper requirements there?
And, it goes from the Secretary of State back to the AG, and then a title and title page are prepared, and then it goes back to the Secretary of State. Well, we actually have petitioned the Hinds County Court to slightly modify the title.
Okay.
And that actually is taking place today. So I won't talk a whole lot about that because we're about to step into court on that.
Yeah, I understand.
We just we felt like that an important part had been left out of the title, and that was that it only affected low-income individuals.
Right. It's all it was. And you and I have visited before on the program on this. Medicaid is a complicated program.
Very much so.
With many nuances, and I think it's accurate to say that the average person, the average Mississippian, doesn't really understand all of those details and all of those complexities, and frankly, they shouldn't have to.
Shouldn't have to.
It's really not sort of a mainstream deal for them. But Medicaid, last time I looked, Tim, in this country covers about 72 or so million people.
I would think that would be real close.
I think 45, 47 on Medicare, 72 or so on Medicaid. Correct. So well over a third of our population covered by one of those two federal programs. There are 12 states, I believe, remaining that have not expanded. And by expanded, explain that for our audience, if you will, Tim.
Yeah, they have not taken advantage of the language of the Accountable Care Act that would enable them to get additional federal funding to a population that doesn't qualify for traditional Medicaid. Mm-hmm. They either make too much money to qualify, or they don't make enough money in order to pay additional costs for commercial premiums. So you're looking at a population from 100% to 138% of the poverty level, somewhere around the $17,000 a year for an individual, 34, 35 for for a family of two would be in that category.
Yeah.
And what it does is you are able to take advantage of 90% funding from the federal government. The states are required to put up a 10% match, and we've talked about that, of course, in the past. And then, of course, those individuals would have access to care, very similar to what you would see in the Medicaid program.
And we should also point out that this group that would be eligible under expansion are typically described as able-bodied adults.
Absolutely.
So the categories and groups of individuals that are presently eligible for Medicaid does not include able-bodied adults, so-called working poor. I think you hear that referred to quite a bit. So it's children, it's pregnant mothers, it's indigent elderly, it's disabled, blind.
Yes.
I believe those are the traditional groups covered under base Medicaid.
That's correct. And, the one thing I have found easy to compare this program to is the CHIPS program for kids.
Okay.
Those are healthy kids that cannot afford other coverage. That's exactly what this is. This is for healthy adults that cannot afford coverage. And, numerous studies have been shown, and about 2/3 of those individuals are actually working.
Yeah.
Some of them more than one job, sometimes 3 jobs.
Yeah.
But they're all part-time jobs, so they have no access to care.
Yeah. So what happens
challenge.
there is that they work in jobs where their employers are small enough so that they are not compelled and required under the law to offer health coverage.
That's right.
Therefore, they don't in many cases. And then they, as you indicated, they don't make enough to qualify for premium subsidies in the Obamacare exchanges. And so they're left in what they call the donut hole there, the coverage hole, the coverage gap, I think is the term that's used. And so how many do you think would qualify under expansion? What does your data show on that?
We say it's somewhere in the neighborhood of 200,000.
Okay.
Many of your studies will show anywhere from 150,000. I think the commissioner of insurance has used up to 300,000 to 400,000.
Yeah.
But, I'm a little more conservative than that, and we try to pull back because we don't want to overstate anything that we're trying to put out there. We're trying to stay with what we feel like is very, very much the numbers. And we feel feel pretty comfortable that it may fall between 200,000 and 300,000. And
so to those, Tim, who would say, well, let's look at the other states that have expanded and how that has had an adversarial impact on their budgets because of their 10% part that they've had to cough up after. Because when it initially was rolled out, it was 100%. Then I think it declined to 95%. Now we're at the 90%, which is where it stops permanently.
That's correct.
So to those that say, well, yeah, it blew up the budgets of, say, Louisiana and Arkansas, I think both of which are states. I don't know if that's true or not. I've just heard that tossed about.
Great question. And I actually talked to a Louisianan Friday, I believe it was, and he actually shared with me that the prior administration left them such a hole in the budget that if it had not been for Medicaid expansion, that was the only thing they had that filled it.
Wow. How about that?
And you find in that, we've compared our program and let me make this perfectly clear.
Yeah.
The ballot initiative does not in any way include the Mississippi Cares program that we've talked about.
Okay.
It doesn't have anything to do with Mississippi True, the insurance company that we set up. That's all separate and apart from the initiative. But we have focused a lot on the Indiana model.
Yep.
And because, we're conservative too. And Pence actually thought this was a really good idea.
Governor Mike Pence at
that time. And they just last year renewed theirs for 10 years.
Wow.
I don't think it's hurting Indiana. It must be working pretty well.
I'll be darned.
Arkansas, Governor of Arkansas, will tell you real quick, the financial stimulus that they've gotten out of that program would have been worth doing it if nothing else happened.
Gotcha.
So I don't hear all these negative things that these other folks are putting out.
And so also let's talk, Tim, about the incentives that have come down. First, we've got an increase in the federal match under the CARES Act of, 6.5%, something to that effect from the federal.
6.2, I believe,
6.2,
right now.
okay.
Yeah, you're close.
Which puts us at, 83% of Medicaid being covered by the Fed.
That's right.
And the state picking up the remaining 17 or so percent.
That's correct.
That has an expiration date on it, doesn't it?
It does. It'll end in March of 22, I believe is what the White House has said at this point. They would carry it that long. Certainly something could happen and they could extend it, but that